So how do you know if you're ready for a facelift? How young? How old? What signs of aging? Let's get into it. Welcome to the center. My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel. The facelift procedures are actually some of the most common and popular plastic surgery procedures. But when we think about facelifts, we're always thinking about an older individual with major sagging skin that comes in for a facelift. However, that may not be true. So over the past few years, as Ozempic and other GLP-1 agonists have taken hold of our society, and the craze with newer facelift techniques such as the deep plane facelift, the popularity of facelifts has exploded. So today, I get this question more than almost any other question. When am I ready for a facelift? And that answer is complicated. So before we can answer all these really interesting questions, what is a facelift? So facelift basically was developed to lift the tissues, sagging tissues of the face. And that's what really, for many decades and generations, its goal was. You get jowling, lax skin, let's lift it. But things have changed over the past decade where we have been able to not only reposition sagging tissues, but reshape the face, create contours in the neck that creates a highlighted jawline, beautiful cheekbones, really taking back and turning back the clock. Whereas with other non-surgical or even surgical procedures, we were really never able to do that. So the procedure has come a long way where we're using much deeper tissue layers so things don't look like a windswept look. You don't see unusual lines around the eyes and face. You don't get these major scars. And as a result, not only has this given us better results, but we've also gained more acceptance that this procedure is really critical in our armamentarium for facial rejuvenation, looking younger, healthy, beautiful, attractive, and the best we can be. So what are the available facial rejuvenation techniques that we have to address signs of aging? So aging process is different for everybody, but it's really a multi-level process. Not only does our skin thin out, atrophy, and start sagging because of a loss of elasticity, we get deeper fat compartments that atrophy, we get bone that atrophies. So as a result, the shape of our face changes, we get fine lines, deep wrinkles, jowling, heaviness in the neck area, and sometimes we have these buccal fat pad that kind of drops down as well, kind of creating a much more square appearance to our face. So the non-surgical procedures do a wonderful job with our skin texture, consistency, the elasticity of the skin. So we use, for instance, fractional laser resurfacing to resurface the skin, make the skin look great, phenomenal option. We use ultrasound, ultratherapy, and other microneedling technologies such as Silfirm and Morpheus to basically improve the texture of the deeper layer of the skin. And we use fillers and Botox to revolumize and reshape the face. Those are really, really wonderful. But once the aging process progresses, and there are also some genetic issues that these non-surgical techniques don't address. For instance, if someone's born with a very small chin or a heavy neck, those processes require a surgical intervention. And that's where facelifts and neck lifts come in for two groups of individuals. An individual that has sagging tissues and repositioned tissues that these non-surgical procedures just can't correct. Also for excessive neck redundancy or early process neck redundancy. Facelifts, neck lifts are wonderful to reposition the tissue back 10, 15, 20 years for you to look really amazing. The second group of individuals are actually younger individuals who have recessed chin, who have a heavy lower face and neck area. and they want to contour and reshape their face and improve the aesthetics of that area. And with non-surgical procedures, we just can't do that. So we use facelift and neck contouring techniques that are surgical to accomplish that. A lot of the same things that we do for the more aging population, we can use for the younger population to accomplish really beautiful aesthetic results that give us fantastic outcomes. So now let's talk about the different techniques of facelifts. And one of the most common things that I hear is, I want a mini facelift, or this doctor told me I just need a mini, or I need this type of facelift or that type of facelift, the branded facelifts. And they're wonderful. I think everyone's trying to come up with ways to kind of essentially discuss or create a terminology for what they're doing. But one surgeon's mini facelifts, maybe another surgeon's maxi facelift. So I don't look at the terminology. What is it that we are trying to accomplish is my primary goal with a facelift, and I think should be your primary goal, which is, are we trying to improve the jawline? Are we trying to improve the lax lower skin? Are we trying to get a better neck contour, better cheek contour, improve the nasolabial folds? And the technique needs to be modified and customized for what you need. Sometimes we have to modify the salivary glands. Sometimes we have to modify the buccal fat pad. As a whole, the approach to a facelift can be skin only, which that technique is really, I would say, old school and didn't give us great results because it just addressed the skin and then it created all these unusual wrinkling effects and didn't last long. Then we went one layer deeper, used this tissue layer called the SMAS. The SMAS is like a structural layer of the skin that's deeper to the skin. And those results were much better. But we got even better by using the SMAS or going underneath the SMAS in a plane that we call the deep plane facelift. And this allowed us to just naturally get the mid-face, lower face, and neck elevated in a beautiful aesthetic way. So today, the modern techniques of deep plane facelifts are the way that I like to approach my facelifts. But once we approach the facelift, that's not where we kind of create a cookie cutter approach. Some people need the buccal fat pad repositioned. Some people need their glands repositioned or trimmed. Sometimes we need to tighten the muscles in the neck. Sometimes we need to do fat grafting. Sometimes we need to do laser resurfacing with it. So you got to customize it based on your individual aging process or genetic factors with your anatomy. So what are the signs that you need a facelift? This is also complicated, but I'll try to simplify it. Number one, sagging tissues that really are wonderful technologies such as Morpheus and Silfirm and other techniques just can't quite get that improved. And I really don't believe in thread lifts personally, because I think those are really pinpoint procedures that can carry some complications and really don't give the ultimate results that we want. So in patients who have jowling or redundancy of lower tissue and neck tissue, that's a great candidate for a potential facelift. If they're healthy, they're non-smokers, if no vaping, all of those things are in place. Second group are individuals who have a lot of heaviness in the neck because of either fat accumulation, gland drooping, fat pad drooping, young individuals who are beautiful and attractive, but they just don't like kind of the double chin or the neck and lower face contour. Again, we use the word facelift, but facelift is really an approach that we have to contour the lower face and neck. And it's just like kind of a rhinoplasty issue. If someone's born with a feature of their nose that they don't like, a rhinoplasty is what we do at a relatively young age. And it's the same thing in the chin and neck and the lower face. So that's the second major group that I love using the facelift approach, the technique, but going and contouring the neck and the chin and the lower. Can someone be too young to get a facelift? If someone comes in and they have like really beautiful features, everything looks good, jawline is really aesthetic, cheeks are in good place, and they just have some, tissue sagging in their 30s, I'd probably say, yeah, that's not a person that we should probably do a facelift for. That's a patient that we can do some of our beautiful non-surgical techniques, fillers, all therapy, and Silfirm and Morpheus, etc. But if someone in their 30s has very recessed chin, glands, heaviness in the neck, fullness in the buccal fat pad area, and again, one person may be very, very happy with that, and another person may not be. So if someone doesn't love that aspect of their lower face, and it's mainly genetic, then that individual can be a great candidate for a deep neck contouring, lower face repositioning, gland modification, buccal fat pad, some of our surgical techniques that do employ facelift technique approach. One comment about revision facelifts. So just like other revisional surgery, revision facelifts requires an extra level of expertise. And all facelifts, all deep plane facelifts, all facelifts require a higher level of expertise. But revision, even higher, because we're dealing with tissue that's been operated on, and as a result, it has a little bit more challenges in understanding the anatomy, the SMAS layer, the deeper layers, etc. Now, there are two reasons that facelift revisions are done. One is that someone had a facelift recently, the results weren't great, something happened, maybe a nerve injury, maybe some other factors that you are just unhappy and you want to revise that issue. That's, I would say, in the minority of the revision facelifts. The majority of revision facelifts are individuals who 10, 15 years ago, 8 years ago, had a facelift. They're extremely happy about the results and now are coming back and kind of asking if they should have an update, a revision. So both are very different, but require the same level of high-end expertise. So that's really, really critical. There's also been a very recent uptick in social media discussions about how difficult it is to do facelift for individuals who've had previous, let's say, Ulthera or Sculptra or fillers that stimulate the collagen or energy-based devices that cause scarring. And I would have to say that that is a truth, and it does require a higher level of expertise because it does change the tissue layers even if someone's never had a facelift. But it doesn't mean you can't have the facelift if you're a candidate for it. It just requires probably one level or two levels higher in expertise from your surgeon. And make sure that if you are going in for a facelift consult, you do discuss your prior history of non-surgical treatments so that your surgeon can be aware of it. And they may say, hey, this is probably a little bit more involved than I want to handle, and refers you to a super expert. So some facelift myths. Myth number one, that facelifts are mainly for women. And that's the farthest from the truth, because some men who have really redundant skin in their lower face and neck area, they can really look amazing and get an incredible outcome. So definitely not for women only. Of course, women make up 80 to 90% of our plastic surgery patients who are getting facelifts, but men definitely can be great candidates. Myth number two, injectables can give the same results as facelifts. So I get a lot of times someone coming in, oh, I'm tired of doing fillers, now I want to get a facelift so I don't need fillers anymore. Facelifts and fillers or volume augmentation, they're a little bit, they have some overlap, but they're almost independent because fillers are really used for volume loss, whereas we use facelifts and neck lifts for tissue repositioning. So it's not really, you need one and not the other, and vice versa. They're almost independent of one another. Myth number 3, facelifts, one size fits all. And that's really kind of one of my pet peeves. Cookie cutter facelifts. I don't like that because we need to customize. Everyone comes in with very different aging factors, genetic factors. So if we do the same procedure on everyone, then people don't look great. So you gotta customize it. Your surgeon has to customize it. And if they're doing the same thing over and over and over again, regardless of your aging process versus someone else or your desires versus someone else, then that's bad facelifting. Myth number 4, facelifts are permanent and prevent aging. That's the farthest thing from the truth. Facelifts will reposition and address the aging process beautifully and dramatically when they're done correctly in the right anatomy and so forth. But the aging process continues. Nothing is permanent in the aging process or in our life. So again, you have to kind of think about like what you need to want, desire, have, and make sure you're realistic about the goals. Myth number 5, facelift recovery takes months and months. And of course, every surgery does have a timing process, and final results do take several months. But typically speaking, facelift recovery is not as significant as some people make it out to be. In the hands of a great surgeon, and in the majority of cases, there's always some variability, and sometimes some patients really have a tougher time with recovery, but the majority of patients, 10 to 14 days back at work, doing their thing, social life, and so forth. And I would say 3 to 4 weeks, everything's looking really, really good. Final results of swelling, healing, and all that stuff may take 6 months, and scars may take a year or more to get to its final place. But as a whole, the recovery in today's modern world and the modern techniques that we're using is not as lengthy as what the myth implies. So in summary, facelifts, when they're performed by a great surgeon on the appropriate candidate, phenomenal, wonderful, and its age really doesn't matter as much as the anatomy and the desires and making sure that those are matched. So that's really, really critical. It does need to be done by an expert surgeon. In my opinion, I think it's a phenomenal, beautiful, great outcomes, high satisfaction rates. But we do have, anatomy that you need to know, technique, artistic, and surgical techniques that are important. So I hope you've enjoyed this video. Please comment below, let us know what you think, and subscribe to our channel and follow us on our social channels. And I look forward to seeing you guys soon.